My name is Melissa Leon, and for today's presentation, I will be discussing arthritis. My presentation objectives are to discuss what is arthritis, how to prevent and manage with arthritis, what are the treatment options, and new discoveries and plans for those with arthritis in the future. Let's get started. First, what is arthritis? Arthritis is a complex family of musculoskeletal disorders consisting of more than 100 different diseases and conditions. Arthritis is often misunderstood as being a disease that only affects the elderly, when in reality, 2/3 of people with arthritis are under the age of 65. Arthritis affects everyone. To date, 50 million Americans have been diagnosed with arthritis. Of those 50 million, 36 million are Caucasian, 4.6 million are African American, and 2.9 million are Hispanic. There are several different types of arthritis, but the three most common are osteoarthritis, rheumatoid arthritis, and juvenile arthritis. Osteoarthritis is the most common form of arthritis. It is a progressive joint disease characterized by the breakdown of joint cartilage associated with risk factors such as obesity, history of joint injury, and age. Rheumatoid arthritis is a systemic disease characterized by inflammation of membrane lining in the joint. This causes much pain, stiffness, warmth, swelling, and even severe joint damage. Juvenile arthritis is an umbrella term describing the many autoimmune and inflammatory conditions that develop in children 16 years of age and younger. When later discussing the advances in medical treatment and research of arthritis, I will be referring to rheumatoid arthritis. In order to fully understand what arthritis is, one needs to understand the severity of this disease. People tend to think of arthritis and just associate it with joint problems. However, each year, people with arthritis account for 44 million outpatient visits and 992,100 hospitalizations. Arthritis is also a more frequent cause of activity limitations than heart disease, cancer, or diabetes. It is also the leading cause of disability in the United States. Prevention, management, and treatment. Although a person cannot catch arthritis, they can take precautionary steps to prevent themselves from getting this disease. But because arthritis is so complex, there isn't just one easy way in preventing or living with arthritis. A person should first and foremost be educated about this disease. Learning the symptoms can help in finding out an early diagnosis. A person should also be physically active. Not only can this help in strengthening the joints and muscles, which are primary areas arthritis targets, but it also is important for being healthy and managing weight. It is important to protect your joints. It is also important to minimize trauma in the joints. For this, people should try to maintain their flexibility and try low-impact exercises to further prevent arthritis. Treatment options vary from person to person because of the complexity of this disease. Rheumatologists practice this notion of treating a patient with high aggressive dosages of drugs at an early stage with the hope that the drugs maintain and stop the disease entirely. This is called the window of opportunity. Associate Professor of Internal Medicine and Chief of Rheumatology at Dallas VA Medical Center, Dr. Salahuddin Kazi, is a strong believer and advocate of this treatment option. The drugs commonly used for this aggressive treatment early on were hydroxychloroquine and azuldomide. The problem with these high combinations of drugs were their side effects: hair loss, dizziness, loss of appetite, severe abdominal pain, eye problems, muscle damage, fatigue, and causing the skin and urine to turn orange-yellow were some of the common side effects patients reported to have experienced. In a recent study, rheumatologists explored the combination of Humira along with methotrexate in patients with early diagnosis. It found that 1 in 2 cases achieved a clinical remission at a 2-year period, and more than 60% of patients showed at least 50% improvement in their symptoms. New findings. Because arthritis is vastly different from person to person, finding cures and medication treatments that work is rather difficult. However, in 2013, the FDA approved the first of a unique class of oral kinase inhibitors called tofacitinib for the treatment of rheumatoid arthritis. Tofacitinib prevents signaling of Janus kinase enzymes and therefore interrupts important signal transduction of cytokines, which contribute to the immune response in rheumatoid arthritis. In this study, the dose would be at 5 milligrams twice daily, intended for adults with moderate to severe rheumatoid arthritis who have not been responsive to methotrexate. Patients demonstrated a clinical response immediately in trials, with the improvement in the number of painful and swollen joints. Results concluded that as monotherapy, tofacitinib reduced signs and symptoms of rheumatoid arthritis and improved function among adults who had failed previous rheumatoid arthritis treatments. However, the endpoint for remission was not met. Though patients responded positively, there were very notable side effects and infections that occurred. Herpes zoster infections occurred at a higher rate in individuals taking tofacitinib than the placebo group. Hematologic abnormalities such as anemia, neutropenia, and lymphopenia were also observed. Because of the severity of these side effects, it is not to be used in combination with other potent immunosuppressive medications or other biologic agents. There is hope for the future. Research has taken this complex disease and made it clear for rheumatologists everywhere to diagnose their patients. Though it may appear to the average person that there hasn't been much improvement in finding a cure for the disease, it is apparent that the research found today has come so far from the past 2 decades it was ago. With further aid from Congress in the development for managing and treating this disease, it can be concluded that those suffering from arthritis can look forward to faster remission periods and less difficulties going about their everyday lives. This concludes my presentation. I hope it was informative, and good luck in finals, fellow classmates. Feel free to leave me comments, and go science!